Good day, I'm Miss Mhea Reyes, student nurse from Mary Charles College. I'm going to demonstrate how to take vital signs. During the vital sign measurement, you will be checking the patient's blood pressure, heart rate, respirations, temperature, pain rating, and oxygen saturation.
Sphygmomanometer measures the diastolic and systolic blood pressure. Stethoscope for auscultation blood sound when measuring blood pressure. Thermometer measures body temperature. Pulse oximeter to measures blood oxygen. Watch with second hand, take heart rate and pulse rate. Face mask and gloves to protect the examiner in any part of the examination. Cotton balls and tissue to clean the items are not disposable. And we have paper and pen. Perform hand hygiene to reduce the number of microorganisms to the hands. I will dry my hands and close the faucet properly.
First, wear mask. Next, gloves.
To protect the examiner in any part of the examination when in contact with blood, body fluids, secretions, excretions, and contaminated items or when disease-causing agent could be transmitted to or from the client.
Come in!
Close the door or curtain for client's privacy.
Good morning, ma'am. I'm Mhea Reyes, your nurse for today, and I'll be taking your vital signs. Is that okay with you?
Yes, it's okay.
Okay, ma'am. May I know your name?
I'm Mara Jane B. Reyes,
May I know your birth date, ma'am?
November 15, 1995.
Okay, then I start with the easiest thing, which is pain. So I'm going to ask her pain level now. This is a very easy and important assessment tool because high pain ratings, if the patient is in pain, it can alter their vital signs, it can increase their heart rate, their blood pressure, and respiration. And it's really important, especially to ask a patient their pain level if they just had surgery or some type of trauma. So to assess pain levels, you can do with various scales. Most commonly we use the 0 to 10 numerical scale. So you can tell me your pain with 0 being no pain at all to 10 being the worst pain you've ever had. What's your pain rating?
0.
Okay, she says she is having no pain, but let's say that she said that her pain rating was an 8. Well, you would want to ask some more questions using codes and document the numerical rating along with the words that the patient used to describe the pain and its location. Next, I'm going to measure your oxygenation status. And to do that you can use a portable probe, one that connects to a bedside monitor. And to do that, we're going to place the device on the nail bed because that's where it's going to obtain the reading. So make sure that you pick some fingers that have good circulation. Inspect the site, check for capillary refill, and inspect for irritation, swelling, scar, and other sign of compromised circulation.
Cleanse the site with alcohol wipe before applying sensor. So we will turn on our device and we will place it on the finger of the patient.
The patient's oxygen saturation is 97.
Remove the device and clean with a disinfectant wipe and then document your findings.
A normal oxygen saturation is anywhere between 95 to 100%.
Now, I'm going to check your body temperature. And some things you want to remember about body temperature is that in adult, it can vary. It can be anywhere between 97 degrees to 99 degrees Fahrenheit. Inspect and clean the selected site if needed with clean towel or tissue. Open the thermometer and check the functionality and place the thermometer in the site properly. And wait for the appropriate amount of time. Remove the thermometer and here is the patient's body temperature. Your temperature is 36.4 degrees Celsius. Wipe it with wet cotton balls with alcohol and dry it with tissue and put it back in the container. Locate the anatomical landmarks to identify the BMI. Palpate the angle of Lewis just below the supraesternal notch between the sternal body and manubrium. Slide down your index fingers down each side of angle to find the second intercostal space. Place your middle finger to the third intercostal space, continue palpating downward until you locate the fifth intercostal space. Carefully move your fingers down the left side of the sternum to the fifth intercostal space and laterally to the left mid-clavicular line. Clean the earpieces and diaphragm of the stethoscope with alcohol swab. Warm the diaphragm of the stethoscope in the palm of hand for 5 to 10 seconds. Place earpiece of the stethoscope into your ear. Place diaphragm over the BMI and auscultate for heart sounds. When heard with regularity, use watch second hand and begin to count the rate. Count of 1 is first sound heard after timing begins. Count the pulse for 1 full minute. Also, assess the rhythm and strength of the heartbeat by noting the patterns of intervals between beats.
Okay, your apical pulse rate is 85.
Next, I'm going to check your pulse rate. Select the pulse point as required. Normally, the radial pulse is used unless contraindicated. Place tips of first 2 or middle 3 fingers slightly and squarely over the pulse point. Do not use your thumb to assess for pulse. Palpate and count the pulse. Count the pulse for 1 full minute. Assess also the pulse rhythm and volume. And observe and count the respiratory rate. The elbow should be slightly flexed with the palm of the hand facing up the arm supported by the heart level.
Wrap the deflated cup evenly around the upper arm. Locate the brachial artery. Apply the center of the bladder directly over the artery. For an adult, place the lower border of the cup approximately 2.5 cm or 1 inch above the antecubital space. Palpate the brachial artery with the fingertips.
Rinse the earpieces and bell with cotton balls. Insert the ear attachments of the stethoscope in your ears and position the stethoscope appropriately. Pump up the cup until the sphygmomanometer is 30 mm of mercury above the point where that brachial pulse disappeared. Release the valve on the cup carefully so that the pressure decreases at the rate of 2 to 3 mm of mercury per second. Identify the manometer reading at Korotkov phases 1, 4, and 5. Deflate the cup rapidly and completely. Okay, your blood pressure is 110/70. Okay, ma'am, thank you for your cooperation. Remove gloves and perform hand hygiene. And I will dry my hands and close the faucet properly.